I welcome each one of you on behalf of the Department of Psychology, American College, Madurai, and our co-associating institutions. They were supporting us from the beginning onwards. M.H. Chellamuthu Institute, Madurai, Madras School of Social Work, Chennai, Redmond Education and Psychological Research Center, and Psychoanalogical Association of different countries, and especially Turkey, and the technical support by Yellow Bond Counseling Center. On behalf of association and the core team members, I welcome you, each one of you, for this webinar session. And I'm happy to introduce the speaker also. And I think you all know that she is a core team member, and she is working as a guest faculty at Department of PG Department of Psychology at Bharatiyar University, Coimbatore. And she is the founder of PRAI. PRAI is an initiative by young enthusiastic mental health professionals. For young chap, they started this initiative, and there, when you look at that social media account, you can able to get new information, and they are really doing wonderful job. They're getting more and more advanced research inputs, and they are collating, and they are giving it in a nutshell. So when we read the content, we can understand, okay, I found some of the materials were very useful for me, especially for learning component. And that's such an initiative they've taken. In coming days, they will come up with more inputs on to promote mental health. So I welcome you, Akshaya, for this session. And the floor is over to you. You can take over and then begin. Now I request Veera to give instruction to the participants. I think many of us are known faces only, and some of you may be new to the platform. And Mr. Veera will give instruction for how you can behave in an organic forum. So over to you.
Good evening. Thank you, sir. Thank you. And welcome our today's speaker, Akshaya Lakshmi, for this one. Dear participants, to have a great session, yes, I request all you video as well audio. If in case of which, make sure to wear decent outfit, and also not move here and there. Can't be shouldn't be a observer distractor. And also all your queries can be clarified in the QA session. So I request Akshaya ma'am to proceed further. Floor is yours, and thank you one and all.
Thank you, Suresh sir, and thank you, Veera sir. And a special thanks to again Dr. Suresh Kumar sir, who is doing a wonderful work, all altruistic as a base, no money, and it's totally altruistic. I really learn a lot from him, and the very core team who are all very supportive as a individual for me. They are very supportive, and also they make sure the sessions are going well. One or the other, make sure the sessions are going well, and it's like more than 200 sessions. It's not a simple thing. Congratulations, sir, and I'm really happy that I'm a part of the core team. And shall I share the screen, sir?
You can, yes. Switch on this video.
Yes, sir. Give me a second, sir. I'm not able. Sir, is my content seen, sir?
Now it may be loading.
Yes.
It's not visible as of now.
Okay. And I'll be sharing my entire screen, sir, so that will be helpful, I guess. Is it visible, sir?
Yes, yes. You can able to see my face.
Now the PPT, sir?
Yes, it's clear. You can go on.
Thank you. So today I really want to speak about the physical health and the mental health, as Suresh sir. Most of the physical health aspect is visible, and hence it is taken into a talk or a discussion, and we go for help. But when it comes to the mental health, And also tomorrow, as it is going to be the Mental Health Day, October 10th, I really want this awareness also to be spread. So I have kept my content as simple as possible, and it will be more for the general population, for the self-supporting aspect, and also for being aware of our own mental health. So that will be the motto of my presentation today. So as kindly participants, make sure you are being interactive so that it is helpful for us to go ahead with the sessions. And Ananya, I yes,
Yes,
that
I made the chat box for you.
yes, yeah, kindly do it because I cannot see the chat box. Yes, it will be helpful. Thank you.
Yeah.
So yes, so before I change my slide, there is going to be a question in my next slide. It is a very, very basic question, and it is a very common question which you ask each other, and we are kind of conditioned to answer that question. So when that question pops up, kindly do not give the conditioned answer, but then take 1 second and think what it is, what is the real answer, and then give it in the chat box. So again, I'm saying it is going to be a very basic question and everyone can answer it, but I want you to answer in a very true way. Give a second a thought about it and then go ahead with the answer. Yes, I'm moving the slide. Yes, the question is, how are you? Kindly take a second and then give me the answers in the chat. Any answers?
Yet to receive.
Don't want to overthink, just take a second and answer it.
Shivakumar sir says he's fine.
Okay.
Maha ma'am says okay. Jayashri ma'am says happy. Reshma ma'am says good.
There's few more answers.
Kanaga ma'am says first thought comes is fine. Padma ma'am is feeling contented. Paul Raj is I'm good.
Okay. Okay.
Ananya is a little anxious.
Yes, thank you. Thank you, Ananya, for reading out the
Yellow
answer for
Pond
me.
is feeling good. I think that is Racer or Veera sir. Yeah.
Yes, thank you. So there is a question again I want to ask you. When I ask this question and all those chats, whatever you have given me, were you addressing your physical health or were you addressing your mental health? I'll give an example. Like physical health means like you are all fine. There was no fracture, or you don't have a fever, or you don't have a cold. So that will be the physical aspect. And mental health is like something happened and you are feeling that way. It's because of your physical health is okay. You have talked something other than your physical health. And what was it? Was it the physical aspect or was it the mental aspect? Kindly say it in the chat, like write it as physical aspect. I answered. I addressed the physical aspect. I addressed the mental aspect. Kindly say it. And
Mahalakshmi
Ananya?
ma'am says, yeah, Mahalakshmi ma'am says mental health. Kanaga ma'am says she is holistic.
Okay, good.
I was also talking about mental health. Paul Raj sir, mostly physical aspect. Yes.
Okay. Yes, thank you. Thank you, Ananya. So that is that.
Sarabdi sir also says physical aspect. Jayashri ma'am says both. Oh yeah, you can continue.
Okay, yes, thank you, Ananya. So yes, we tend to answer this question. Usually, what happens is when someone asks us like, "How are you?" Yeah, I'm fine. Yeah, I'm good. When someone like a third person asks, not a very close person, you just give a very social answer that yes, I'm fine. Yeah, I'm doing good, and like that. But when we really ask that question, "How are you?" or "How am I?" we take a second and just have, okay, we analyze and then give the answer. And there is again a few of them had said like holistic and some said like psychological, and some said the physical. So that is the importance of this. When we consider both the physical and the mental aspect, then the holistic aspect comes. And how are we really, even if I ask how are you feeling now, there will be another answer for that. So we will be more discussing about this aspect, the physical and the mental aspects, where I will be saying what is physical health actually and what is mental health actually, and how it is related, and what we actually, how much importance we actually give for both of it, and we will value it. So yes, thank you for answering all the participants. Thank you so much. So yes, moving on to the presentation. So what is physical health actually? It is defined as a state of well-being when all internal and external body parts, organs, tissues, and cells can function properly as they are supposed to function. So we can observe all these things. And it also includes a state of physical well-being in which a person is physically fit to perform the daily activities without restrictions. So I have had good food, I have had good sleep, I have some energy to work, so I am working. So that is more of the physical health aspects. And when we speak about the mental health, there are three components very important. What are those is, mental health refers to cognitive, behavioral, and emotional well-being, which is, it is also about how people think, feel, and behave. There is a very beautiful connection between how we think and how we feel and how we behave. These three aspects, it's like informed, or there are a lot of theories that gives the connection between all these things. So for example, it's again I'm saying this is for the general population, so I will be more of the basic concepts will be explained. So when we think about that, for example, let me say, so there is a person who came to me, and someone said something bad about a person whom I'm going to meet tomorrow. So what I will think is, I already have a idea that the person is going to be a person who is going to be bad in behavior. So I start thinking about the person. The person is going to be a bad person and everything. And when I start interacting with the person, I start saying yes, this person is a bad person, and start feeling hatred, or probably I start feeling hostile with that person. And then what happens is, and how I behave is also based on my thinking and feeling. So probably I will be away from the person, or what I can do is I can show the anger towards that person. So this is the beauty of the mental health. And the very important thing is, there is a stereotype attached to this. Who speaks about mental health? Is it only the mentally ill person? Are they the person who has to take care of their mental health? If that is a question, we can say with this definition, there is thinking aspect, there is feeling aspect, and behaving aspect, which are all the human beings think, all the human beings feel, and all the human beings act out or behave. So what is the whole thing is that we as human beings think, feel, and behave, and hence we all have a mental health which has to be taken care. Again, the WHO stressed that mental health is more than just the absence of mental disorder or disability. It is not only for people who wants a psychiatric help, or a person who wants to go for some psychologist counseling, or a psychiatrist medical prescription. It's not for them alone. It's for every human being. So that's what WHO also is stressing. And yes, so this is a beautiful thing that we as human beings, we as people do when our physical health is affected. What do we actually do when our physical health is affected? One thing, for example, let me say, when I was going for a jog, I got my ankle sprained. So when I get that pain in me, I shout out, or I just say it's paining. So that time what happens, there is a friend who comes and helps me out. Or after the person will be helping me to go to a room or something, then I can try out if it is a smaller pain. What I do is I can just try out some medicines or sprays, and I try to recover. If that also doesn't work, what I do is I go to the doctor. So when I go to the doctor, what happens? He or she tries to give diagnose what is wrong, and then give some medicines and ask me to take rest. So I take rest. Sometimes, yeah, nowadays online things are there. So I work from home, but yes, I can take rest. I can apply for a leave saying that I have a leg fracture, so I am taking rest at my home, and it is allowed, and we move ahead. Like, yes, I recover from my physical health issue, then I go to the job. So this is how everyone react when we get a physical health issue. So when we have a mental health issue, or mental health not an issue, it's just a small level of depression, a mild level of depression, or the level of stress is getting high, and all those things, how do we actually react? And also when it comes to a lot of other problems, like where I have issue but I'm not able to say it out, I choose not to say it out. There are a lot of other reasons. I have put this picture because I really want to emphasize this aspect of children involved in it. As a child, when the child is not given support to open up their emotion, to open and say that this is how I feel. This and also I have given this picture shows a boy looking at the light, covering himself. So usually what happens is, even now, even educated people, what we train our child is, a boy's child should not cry. A lot of people, ஆம்பளை புள்ள அழக்கூடாது. Okay, you can say the children, you can say the children that you should be strong enough to handle the situation, but it is not due to the gender aspect. So are you saying that a girl child can cry? We can just leave that. Also, some children take it in the right way. Okay, I should not cry, I should look forward. I should look forward and go ahead and ask for help and clear the issue, so that I can actually be fine again. But some children try to hold themselves very much that they don't open up, and that reflects their personality later. There are a lot of studies that are, even now, there is a term called emotional expressivity. There is a lot of research that is being taken care. So that is the one thing. One thing is that we, based on the reinforcement that we got from the childhood, we don't give much importance to say out our emotions, so we go into our shell. And also there is another thing that we do. All human beings right now, it became a trend that we all are good actors or actors, very good actors, that no one is able to find that I'm not fine. So this also happens, like there are a lot of other reasons. I'm not saying that this is the only childhood trauma only is the problem, or the person is not brought out that way. No, it's not like. There are other reasons also. But the thing is, the exact support when we are giving them, then only we can actually go ahead and understand that there is something wrong. We have to encourage the children to open up, to speak out their emotions. And this again, there is a beautiful picture here, okay, where our friends, what they do is, usually when I'm not fine, everyone are energetic and all those things. They want me to come out of it. So usually in a genuine manner, they say, come, we can go for a party, then come, we can go and enjoy ourselves, don't sit like that. That kind of things people say. But actually what I need is, I want to speak to someone my real emotions and sort out it totally, not only just distraction. I want more than that. So I have a beautiful video for that. So I will be sharing that video so that you can kindly listen. You see the video, also listen to the comments that is given by our own friends. It's a video saying how it will be when the mental health, when the physical health is treated like the way mental health is treated. So that is the thing. So I will be sharing you. Kindly someone say me if the audio and video is visible and audible. It will be more helpful for me. Okay, I'm trying to. Okay. Is it visible?
Visible.
Yes, thank you. I'll make it as a full screen, and kindly let me know if the audio is also there. Is it processing?
Yes.
I'm sorry for the technical issues. Um, yeah. Give me a second. I will just connect it to some other network. So. I don't know. Am I there? Network.
You are in the meeting, Akshaya. The
Yeah,
PPT is not full.
Sir, do me a favor. You can send me the link, the video link. I will pay it from my side. Share me the link to my WhatsApp number. I will try to play from here.
Am I there, sir? Am I
No,
audible?
you are audible, but I cannot see your video. You just share me the link here, the YouTube link. I will play from here.
Give us a minute, participants. Now she's joining me. Sorry for the inconvenience caused.
Yes. There is no link in my WhatsApp number also. Probably it's me typing in the number.
So can you hear me, sir?
Yes.
Sir, I will ask Akshay to, use my account, sir. Because she's
Okay.
not able to join, she says. I'm sorry.
Okay, it's okay, no problem. See, if she is having the link, we can share it in my WhatsApp number. Just share me the link, I will try to play it from here. I think she is the one coordinator for the past 1.5 months without any technical issues. For today's her session, and she is facing technical issues.
I'm sorry, sir. I'm here. I will send you the PPT. Kindly share it for me, sir.
Yeah, okay. My WhatsApp.
Yes, sir.
You just continue.
Participants, kindly, I'm really sorry. Give me a second. So till the PPT is shared, I will continue the session. That will be fine, I guess. I have sent it to Ananya. She will forward it to you, sir. Thank you. I'm really sorry for the technical issues. I had never expected that. Okay. So the video usually, if possible, I will share it again. Okay. So usually what happens is we tend to, if a person comes and he or she is saying that I feel a headache, I want to go and sleep, or if I feel I am feeling stressed, so I want to take rest, so I cannot join a party. What we do is, it is a common thing. You really don't want to give much importance to that. Don't overreact to that. We tend to stop them abruptly without hearing to them. So that is the usual attitude, even as a friend. Even though we are genuine, we tend to do that. So, as a person who can help as a friend, what can we do is, one thing is be available. This is a very common thing. Even as children, they tend to understand if a person is having a fracture, a hand fracture, or a person is having a leg fracture, the other child will come and help you with walking or to carry something. But other children thought, if a person is moving away from them, is it okay to go and speak to them? So that aspect, even now, even as adults cannot be sure that how can I help a person if I can be available. I know that I have to be with my friend. I should go and sit and I can go and talk. Okay, to some extent I can talk, but after that, what I can do? So for that, I have some general things that can be helpful for us to really be a support to a friend. So one thing is that be available. It's not that we as a person have to go and be available. Just I'm just getting distracted. Yes, as the video is playing. I'm sorry for participants. We are. Yes, kindly.
halfway through the vibe. Just it's like you're not even trying to walk. Have you ever tried not having diarrhea? God, my migraine is killing me. Take meds for that? No, my God, dude! I cut myself and it looks really bad! Some people have it way worse than you do. You have to chill out. So I guess you're not going out with us tonight. Such a flake. Oh man, I really think I sprained it this time. I gotta go see my physical therapist. Therapy? Yeah? Whatever, Bruno. Can you hold on 1 second? Honestly, your attitude sucks. Another insult. Yeah, I kind of have to. Have you ever thought about dropping the pharmaceuticals and fighting this natural like diabetes? Enough is enough. It's a beautiful day, man. It's time to get up. Dude, I just got eye surgery. Yeah, like a week ago. Well, it still hurts. Oh, I think you're fine for himself. I know. No, he's fine.
Yes, thank you, Ananya, for that. I also have mailed you the PPT if possible, kindly share. Yes, personal, I guess, even though it was the video was not that clear, I guess you got the concept. So, can anyone share what did you observe in that? You can unmute yourself and say, or you can chat. I can see the chat now. Yes, okay. I'm not sure if you are able to see the, yes, thank you, Ananya, the PPT is visible. Thank you so much. Okay, go to the video slide. Yes, this slide, yes. Yes, this is what I was speaking about. So, yes, Reshma, thank you so much for replying. Taking care of physical health, particularly injury and ill health. Yes, correct. So if you had observed, yes, thank you, ma'am. So if you had observed that video, there were a few scenarios where a person actually had a eye surgery. He was in the bed and one of the person opened the screen and it hurt him much. When the light touched his eyes, it was painful and he said, don't do that. And the other friend said, okay, it has been a week. Why are you not recovering yet? And there was a person who was walking and he hit his head on a tree. Okay, and the other person, he said, oh, it's paining. And the other friend, what she said was, don't keep complaining. And a person was in a wheelchair, and when he was going, and the other friend said, stop, have you ever tried walking on your own? So all these things, and one of the person who was vomiting, and other friend said, okay, this time also you're not coming for a party, you're skipping it. So this is how we actually treat our mental health. Usually, all these scenarios, when a person has a eye operation, we tend to give him a month at least time to come out and get recovered. And if a person is hitting himself in a bar, what we do is, hey, are you okay? We tend to go and ask immediately, are you fine? But if that aspect is treated like a mental health aspect, like not giving much importance, stop complaining, it is just a small hit, you don't want to worry about it, you are overreacting. All these things, if it is being said in a physical health aspect also, then we will know the difference between how we are treating actually our mental and the physical things. There is a big difference between that. And to say the truth, the mental health, that also, the emotional pain is also equally painful like the physical pain. When a fracture happens in your leg, what happens is you have that
very sensitive to any touch. So you shout, you feel that pain. A person is feeling depressed, just like that a person is having a severe headache due to stress. All those things have equal importance and the pain is same, but we don't, as a human, we don't give much importance to that. So what we can do actually, if such a situation comes in and we can see, I said no, there is a child who can actually visibly see that the person is having difficulty in walking, so I help out the child. But are we really helping out the child who wants to really hear out the problem? Are we doing that? So for that, what happens is we can do few things as a common person, as a friend. We can do all these things. So one is be available, as I said. Be available to listen to what is being said. Ask them to share as much or as little as they want. Again, as much and as little as they want is, you cannot go and ask your friend, you are my best friend, you have to say it to me. Am I not there for you? Such kind of sentences focusing more on you. Okay, the sentences has to be, yes, I understand that you are going through something. Do you want to share it with me? A genuine thing, yes, you do it genuinely. I do say that, yes, when you say I'm a best friend, you can share it with me. The understanding level is different from the person who wants to open it. The person wants someone to listen and not talk. So be a person who listens quietly, and you don't want to keep on pressing them. Yeah, you say it, you say it. Allow them to say how much ever they want, but give them some space to say. And don't try to diagnose or second guess their feelings. This is something very important, because there was a personal experience also. There was one of my friend who called me and said, my brother is going to college next year, so I'm not sure which college to join and what has to be done. And she was speaking about, she was so concerned that he was very playful and he was not he was not serious enough to go for a college. So I asked her, okay, and she said that I keep on advising him. He keeps on playing in his mobile phone and doesn't respect the elders and everything. So I asked her, okay, how close are you with your brother? So when I asked that question, she said, okay, I used to be very close during my childhood, but right now, 5 years I was away from my home. I was in the hostel, so we speak very less. But I do care for him very much. Okay, I understand that you care for him very much. So, did you ask him what is his plan and why is he behaving that way? She said, no, I didn't ask him, but I can see that he's not serious and he doesn't want to go for a proper college. So when I asked her to go and just speak and come back, she after 2 to 3 weeks she called and said this. I went and tried speaking, and he said he has a very clear-cut idea about his career. Okay, he wants to pursue BCom, and this is the reasons, and he has seen a lot of colleges and everything, but he had kept everything within himself, because he thought that his family is not going to listen to him. So that is the attitude. So when why I say is this, because we don't want to guess the feeling why they are behaving that way. Is it because they are childish? They are not they are not responsible enough. That's why they are behaving. We as a person observing doesn't say that this is what they feel, this is what they are. No, you ask them. You can see that there is some kind of difference in their behavior, but only if you ask them why that behavior has come, what is going on, will they come and say it. Keep questions open-ended. As I said earlier, don't want to say, okay, are you feeling this way? Yes, no, not like that. You are. How are you feeling? Can you say, explain about it? Yeah, please try to open up. Talk about well-being. Yes, we can overcome it together. Like that, you can speak. Listen carefully to what they tell. Very, very important. And offer them help in seeking professional support and provide information on ways to do this. Yes, let me say it like very frankly that kindly go to the back slide. So this is very much important, because There are few things that you as a friend can do it. Yes, I know that for every problem there need not be going to a counselor or a psychiatrist and get some counseling. No, a friend, a person usually who listens to us is there. We can actually handle the situations. But when the problem happens is there is they have something to say and they are suppressing their emotions and there is no one to support, then it bundles up and then it comes into a bigger problem. Other than the personality problems, those things have different issues, but in general most of the problems can be solved within ourselves if a proper support is provided in the following ways: listening carefully and looking for what is required, and if it is needed, going for a professional support. Know your limits. This is not an offensive statement, but this is the reality. Yes, I have studied counseling psychology. I can give counseling, but some disorders like schizophrenia, or there is some like high level of depression or bipolar disorder, there needs to be extra support where medical supports from psychiatrists needed. So I cannot say like I will be there and I will be solving everything. No, where there are some limits to us, and let us be open enough to accept that and go for the other help. And you can be as a professional support and provide information. Yes, those who are attending our programs, let me say, like there are a lot of psychologists in the core team, webinar core team. So you can approach us, and whatever help we can do, we will be doing it. So yes, so know your limits and also don't hesitate to be a support to your friends. Next slide, please. Yes, this is very, very, very important. Okay. Only if we take care of our health, we can be in a state to listen to others. So for this, I have few things that I can actually give as a thing that we can actually do for ourselves to be in a good mental health and also physical health. This is very real when even though you are a person who is very much willing to do a help, but you are not in the state to do it, you cannot do it, then you will be regretting. So it is very important that we take care of our health, then only go for others. Don't push yourself to help others also, first take care of yourself. Next. Okay, yes. So there is a beautiful connection between the physical health and the mental health. And there are a lot of research studies which say there is a strong relationship between the physical health and the mental health, and we will be seeing the connection. Next slide, please. Yes. Yes. No. Can you keep that first picture alone? Yes. Thank you. So this is a very simple example of effects of stress on the body. Stress is a psychological concept, and when we are having that stress affecting our own physical body, these are the parts that are affected. One is the brain and the nerves, where we have headaches, feeling of despair, lack of energy. Headache is a very common thing when it comes to stress. Most of you can even say it in the terms like, yes, I'm stressed, so I have a headache. Yes, that happens, which is a very clear example of psychological connection with the physical connection. Heart, faster palpitation and blood pressure and everything. Stomach, nausea. When you are stressed and there is a lot of pressure on you, you feel nausea and stomach ache is there, and pancreas, increased risk of diabetes. Intestinal issues. Diarrhea is one of the there is a cause of stress in diarrhea, constipation, and other digestive problems and reproductive problems there, where female usually get irregular periods, and also reduced sexual desire. For men, impotence, low sperm production, and reduced sexual desire, everything. There is a lot of this. This is one psychological aspect which has a lot of physical connection to it. So one is affected and the other is, and it's also vice versa. When we have some physical, if you're not taking good food and if you're not having a good sleep, there is a lot of psychological problems that comes along with it. So that is also needed to be spoken. So other thing is, yes, I wish people. Yes. Yeah, kindly back slide, please. I'm sorry. Yes, I wish people knew that my mental health is so physical too. It's like the same thing, but yeah, painful jaws, teeth, and we have upset tummy, and bitten, sore fingers, and restless legs. Everything comes under the connection between the physical and the psychological health, mental health. Yes, next slide, please. Yes, kindly stop it. Yeah, no, go with it. Okay, yes, thank you. Just stop it here. So, what we should focus? Participants, kindly let me know. So, in order to have a good physical health, what are the things that we can focus? And in order to have a good psychological or mental health, what are the things that we have to focus? Kindly text me in the chat box. First, physical health. For having a good physical health, what are the things that we do? Sleep is very good. Sleep. Food is already said. Diet is. What else? Exercise. Yes, correct. The most important two things when it comes to physical health is the diet and the exercise. It's proper exercise and healthy food. Yes, correct. All right, sir. Chandranam, thank you. Yes, that is the two things. And what do you think is important to have a mental health, a good mental health? Good thoughts, yes. Kindly stop, Ananya. Yeah. Happy minds. Good. Meditation, yes, correct. That will be more of the physical. Yeah. Yeah, positive. Yeah, meditation comes under psychology. Yes, positive thinking, good sleep, exercise. Okay, we are mixing up physical aspect and the mental aspect. Yes. Okay. Yes, but whatever you said is about our health. It's correct. A holistic perspective is correct. So, Ananya, kindly can you show the next pictures? Yes. These two things, healthy coping skills and healthy relationship are very important. It is the research has proven that. Usually we say that there is a connection between the physical health and the mental health, but when they look for the components of how it is related, these are the four things that came into light that food and exercise are for the physical health and healthy coping skills and healthy relationships. Coping skills, yes, we will be speaking about coping skills again. Food and exercise, I'm not speaking much about it because there are a lot of nutritionists who had already spoken about it in our own webinar series. And also everyone knows much of it in general that food and exercise is good, but the question is whether we are actually doing it or not. Are we taking care of it or not? But when it comes to the psychological or the mental health, the research has proven that healthy coping skills and healthy relationships are very important for us to have a good mental health. So healthy relationship is coping skills. I will speak about it later. Healthy relationships. We human beings, anyhow, whatever happens in our life, we are going to get in contact with people. We are going to form relationships. We are going to interact with them, communicate with them. So for having a good relationship, also coping skills is important. When something happens, when something is going wrong with our relationship, we get more hurt that we cannot go further into our life. So for that also, healthy coping skills is important. So next slide, please. Yes, types of coping skills. See, these are very basic. I'm not going much into it, but yes, this comes according to the intensity of the problem. If the problem is very basic, just like a mood upset or something, yes, we can do all these things. Like stress ball is there, I can just press it and I can hear to some music. I can see some good pictures and change my mood. Taste, like actually, there is a proven fact that chocolates and the sweet actually helps us to improve our mood. So candy helps, and smell, candles, perfume, everything helps. And to a little more intense problem, that things keeps on coming in my mind, so I can distract myself. So when I distract myself, probably which takes my full attention. Sometimes when we read the book, we give our full attention to that. Movies, a colorful image and a lot of music in it helps us to distract ourselves with that problem. And there is opposite actions, like we are, as we are saying, like affirmations and inspirational motivational talks, all these things helps. And emotional awareness, this comes to the very psychological aspects where we kind of identify ourselves with what is the problem, and then we move ahead what can be done. Emotional awareness is very much important. And mindfulness, everyone, mindfulness basically like being in the present. What and all techniques that actually helps us, the meditation aspects. We try to say that I have for a meditation along with gratitude, we can say like thank you for my eyes. I can say thanks to my nose. I can say all these. I can name the parts and say thank you, and I can be more in the present. And the crisis plan, this is very, very much important. Okay, so I will give a very simple example for this. Okay, there is a person who comes to you today, and you had a very bad fight with that person, let us say. So, and you know that the next time also when the person is coming, I will be having a fight with that person. You have a plan. This I am saying in a very simple term for our general population, like general day-to-day life. So I know that I'm going to have a fight with them, and I'm going to feel very bad next time. So I'll be prepared how to handle that person next time. So this is very much important, being planned for our crisis. Usually we don't expect our crisis to happen to us, but there are few things that is going to happen. Like, yeah, I'm going to see that person, and it's not going to end well. So I'm going to have a good, be prepared for that situation. So I can do that. And yes, there are this 104 is a phone number that you can contact in order to get a psychological support in Tamil Nadu. In 2013, the Chief Minister, she framed this plan where we can call at any time, 24/7. Clinical psychologists are there to help you for any kind of issues that you have in Tamil Nadu. This is Tamil Nadu. You can Google and see for other states, and for general Indian phone number also. You can get it in Google. Yes, next slide, please. And another thing is a healthy and unhealthy relationship. As I said, relationships, you cannot avoid a lot of things. Especially when you are in a relativistic culture like India, it's going to be where you are going to be with our family, and there is relationship that we give importance to, most of us, I'm saying. So how the healthy relationship usually has this compliments. People compliment you, forgive you, you forgive people, appreciate it, partner, respect, trust, support, communicate, validate, encourage, everything. And this usually we don't appreciate the healthy relationships actually. When we take it for granted. But when you go see, if you have a healthy relationship, be thankful for that. Take a second to think about, yes, I have a healthy relationship and I'm thankful for that. And it helps when you realize, when you are aware of that fact that you have a healthy relationship, it actually helps us to have a better mental health. That is the truth. And unhealthy relationship is people keep, like sometimes people criticize, sometimes it's hold grudge. That sometimes aspects is okay. In our relationship, we fight and do everything okay. In anger, something we say, but later you forgive the people. If the criticizing aspect, disrespect, insulting, compete in a bad way, okay, like I will put you down and I will move forward, that kind of distress, all these things, I won't say don't give up just like that, okay. As human beings, everyone makes mistake. You can give them time to change. Like how? be assertive and say to them like okay, I'm feeling bad. I feel hurt when you criticize me, keep on criticizing me. So I can say it once or twice, but then when I again ask when the person, after you say also the person keeps on doing it, kindly have a second thought on it. You are worth more than that. Remember that you are more, and the very important thing is in a relationship, let us say like you are bending, okay, like backward, you are bending backward, you are standing and you are bending backward. To one point you can bend, okay. After that, if you force yourself to bend, you will break. So that is how relationships is same. Even though if it is going to be a hard or anything, but make sure you get support. That's why we are having for a good mental health, it is important that you avoid unhealthy relationships. You cherish healthy relationships. Try to go for healthy relationships. Yes, people are there. Kindly avoid. If not possible, there are coping strategies. Try to handle it. Yes, next, please. Yes. This is something very much important. As I said, children are the people who are whom we can actually mold now. We can give an environment where we can actually make them physically strong and also mentally strong, psychologically strong. So let us say I'm just going to take 2 more slides and finish it off. Yes, next slide, please. This was one picture that I recently went through. What I learned in school, how to multiply 8 into 7. I learned it, yes. What H2O stands for? Yes, water, I learned it. But what I really wish I learned in school, importance of mental health, how to take care of myself, how to be mindful, how to handle the emotional problems, how to regulate my emotions, self-esteem, how to improve my own self-esteem, about personal finances, reframing negative thoughts, importance of sleep. All these things when we teach, children are the people who can learn without much restrictions. When we become adults, about 30 years or something, our personality is already formed, and we have a lot of things that is already in our mind. So it is really hard for us to change. But the children are the best people to whom we can actually give a better mental health. So these are the things it's best that we can give for the people. So this one, I felt like, yes, people are speaking a lot about mental health, and this is one of the important things. We learn a lot in school, but it is best that we also learn more about mental health. Nowadays, a few schools are actually doing it, but not in a very intensive way. Yes, next slide, please. Yes, I chose this image because there is if you could see it, label the feeling. A boy standing with a thing sad written on it. Okay, this is coping skills for kids. It is very important that they understand the emotions in childhood itself. We learn that empathy naturally. See, children learn from their parents. They model their parents and do it, and the teachers who are there. So if the teacher is so empathetic and says, okay, if you are feeling bad, yes, I understand, you can talk with me. If that kind of teacher is there, the student is going to be the same person in future. If the parent is there, and if the child is coming and saying that I have this issue and I want to talk with you, and you are abruptly saying, no, I have some work, you can go. So the child is also not going to understand the fact that people are supposed to go and ask what is there, and we are supposed to listen to them. They get reinforced saying, if there is a problem, if someone is coming to me and saying a problem, I will not be hearing because my parents did not hear me, and that is the right thing to do. So labeling the feelings, we can have small activities of emojis and say what this emoji means. Emojis are like, everyone knows, I think, like what we used to text in WhatsApp, that small icons. We can use those things and make the people and the children understand it. Reading, all this helps as a coping skills. Breathing exercise, yoga, artworks. There are a lot of research studies which has made it clear that artworks and yoga and exercise and positive self-talk, all these things have helped people to improve their mental health. Yes, next slide, please. So I'm actually finishing off my thing. Yes, let us be aware of our own mental health and also be a support for others. So my references. Next, Ananya. These are my references and thank you. Next slide. Yeah, thank you. And I'm really sorry for the technical issues. I didn't expect such delay would happen. I will try to get back to my system if possible. 1 minute, sir. Yeah. Yes, sir, I am here. I'll be here. Participants, if you have any questions, you can.
Yes, if you have any questions related to the presentation on health and mental health, the realistic view presented by Axel Lakshmi, I can say there is an huge improvement in her presentation. The way in which he delivered and given importance to that key points are really amazing. My appreciation for you for today's presentation. Yes, I think I can see Kanaga Pradap Madam also given that positive feedback, and Satya Fatima too were given that positive feedback to you. And any questions, please unmute yourself and then you can put your question to accept.
Yeah, sure, I can. Thank you so much, sir. I'm really sorry for the technical issues. I expect that.
So sometimes no one is exceptional. And it's very well and very good also. Presentation today. Yes.
Okay, I will share the telegram in the telegram of the PPT. Sure, ma'am.
Okay. So Salim sir, are you there? Ekta?
Yes, I'm here.
Yes.
This is most important physical object. Okay, there is one question, sir.
Yes.
Shall I answer?
Yes.
Yeah. Okay. Kanaga ma'am has asked. Kanaga Pratap has asked, which is most important, physical or mental health? The answer is both. So that's what it's like. One affects the other very much. It's like I have spoken much about how the mental health affects the physical health. Like if you are having if there is stress, as I said, there was a picture that I had already shown you where it affects your if it even affects your headache, or you get some chest pain. There are chest pains and there is diarrhea problems. All these things come because of the mental issues in the mental health thing. And there are a lot of things where when people are stressed, there are a lot of face. If you see, there are a lot of pimples. If you do, doctors are very much aware. When you go to the doctor, they say you, okay, when they diagnose you, they ask you, okay, do you have an exam? There was a situation when I was asked this question. Do you have an exam? Yes. So that is the problem for why you got pimples in your face. So that such kind of things also happen. And also physically, if you don't sleep for a longer for the right time, what happens is you tend to get a lot of distraction. You feel dizzy during the day, or there is like you cannot concentrate on your works, which can actually, and you feel irritated. You start showing it in a behavioral aspect. So both, you have to have that 4 aspects that I mean: food, exercise, coping strategies, and also you should have the good relationship. So all the 2 things are important. Physical aspect and mental health is important, equal important. That's why I'm speaking about. Yes, thank you for the question.
Thank you, Axel. And now I request Dr. Salim to give a brief feedback and Ekta for voting.
Yes.
Salim sir, are you there? Okay, we'll move on to water. Thanks. Ekta, over to you.
Thank you, Suresh sir. Thank you, Anala Lakshmi, for an amazing presentation. The whole
I'm sorry, Ekta. I'm Akshaya. I have logged in with Ananya's.
I'm so sorry.
All credit goes to her most of the time.
Different problems. Thank you, Akshaya.
Thank you.
Despite the technical issues, I think it was very, very well received from the participants in terms of very clear understanding. In fact, you gave us a lot of practical ways of doing it, which is what something that I listened to it very, very carefully. So thank you so much. On behalf of Department of Psychology, American College, Madurai, and the core team members, I take great pleasure in thanking all of the participants for being a part of our session today. And tomorrow it's going to be a bigger day for all of us put together. So I request you all to please join us for the session tomorrow. And thank you, Suresh sir, for leading this whole thing. And thank you to the entire team for being a part of the session today. Thank you, Akshaya Lakshmi, again. Thank you so much.
Thank you, Ekta. Thank you, Suresh sir, for the opportunity. Thank you so much.
Thank you. Thank you, Ekta.
We will see you tomorrow for yet another very, very important session. So
Yes.
join us.
Tomorrow is a panel discussion. Good.
Thank you.